I think that the organization is going wherever society suggests it needs to go. This is a very responsive board, and with that, it would be very difficult to predict without knowing what environmental externalities are going to suggest that the board move in one direction or another. I think it's much more enjoyable to not predict and to just simply state that one of the goals of the board is to be a dynamic body that answers not only its diplomates, but answers the needs and the desires of the public it serves.
I think the ABOS has been really responsive in identifying the best way that people want to maintain their certification. So they recently did an assessment, a survey of their diplomates to decide whether people wanted to continue with a maintenance of certification general exam or subspecialty exam, or if they wanted to do an oral examination, or if they wanted to do a web-based longitudinal assessment. And I thought that was really forward-thinking.
I think one of the most responsive things that the ABOS has done are the practice-specific recertification examinations, because one of the complaints that I heard repeatedly is, for instance, I'm a trauma surgeon, I have to go back and learn pediatric congenital hand so I could take the recertification exam even though I haven't seen a child with a deformed hand in 10 plus years. And so for us to enable orthopedic surgeons to be re-examined with an examination that's specific to their specialty is a tremendous change. And I think that this will be satisfying to a significant amount of orthopedic surgeons. And as a matter of fact, I'm taking the recertification examination in trauma later this year.
I think when we talk about continuing certification, people want it to be relevant to their personal practice. And I think we've heard that and listened. And we will have eventually 9 or 10 subspecialty exams. So in any subspecialty in orthopedics, we'll have the ability for you to take a written exam in your field. And then I think the longitudinal assessment for people that may be in their second or third recertification and don't want to take a proctored exam, that it will give them the ability to remain current by reading a minimum of 15 articles of their choice, and then taking some very focused, straightforward questions, just really to show that you had looked at the article and read the article.
Have we seen a change in the behavior of the American Board of Orthopedic Surgery? I think the answer is absolutely yes. Our fellows from the American Academy of Orthopedic Surgeons spoke up, and over time they have said we need these parts of the assessment to change to fit our needs. We want to do this, but it has to fit into our needs. And the board's been responsive, and I think over the last 6 or 8 years, that's demonstrated by new programs, new ways of testing, simplifying the case submissions. Almost every part of the ABOS process now has been altered in direct response to their diplomates. Not every organization does that.